GINA 2025 has been making our lives easier by making more structured, practical improvements in its approach to make a better and a logical diagnosis for asthma in 2025. I am Dr. Manjunath, a pediatrician and allergy specialist based in Bangalore. To begin with, the first major update has been in the diagnosis of asthma. A dedicated diagnostic flow chart for 6 to 11 years has been made. This presents a clear diagnostic algorithm tailored for this age group, something which was missing in the previous years, which was actually generalized. It also emphasizes on the clinical pattern of variable respiratory symptoms. And it also gives emphasis on the spirometries and the PEF variability, which is 12% in spirometry and 13% for PEFR. There has been also greater importance given for the biomarkers, FeNO of more than 50 parts per billion and eosinophil count of more than 150. These help in making a diagnosis of asthma and also help in phenotypic assessment of asthma. These should not be taken as standalone criteria to make a diagnosis of asthma. These are some of the changes what have been made for the diagnosis of asthma. Coming to the management, now the maintenance and reliever therapy or the MART therapy, that terminology has been replaced by the name anti-inflammatory reliever therapy, AIR. This is to make a broader spectrum of patients and the therapies included in our treatment. The concepts change, whereas the treatment modality still remains the same, and that is in track 1 ICS formoterol is the preferred therapy, and in track 2, which is the SABA, as a reliever therapy. This is to prevent. Now they have been giving more and more emphasis so that there is more and more emerging evidence that this is the most preferred therapy, just not for the maintenance but also for the adherence of inhaled corticosteroids. And of course, there has been warnings given against the montelukast uses. And in the management of asthma, now what they have made a very, very significant improvement, and that is remission as a goal for the first time. The assess, adjust, review cycle now includes remission as a potential goal in a well-controlled child, either on or off treatment. And for this step down strategy, which has been much more defined, now it was previous GINAs were more cluttered. Now it has been given more clarity, where after 3 months of control, now they're asking us to come down on inhaled corticosteroids. These are some of the changes what GINA has brought in for 2025. I believe these are very significant and will bring a sea change in our approach for this year. Thanks for tuning in. Please like, subscribe, and share the channel.